Today's topic is going to be how much does IVF cost in Canada? Now, briefly, a single IVF cycle in Canada costs between $10,000 and $20,000, depending on the clinic, the medications and dosing, and additional procedures or add-ons like ICSI or ICSI and genetic testing or PGT. Several provinces now offer public funding or tax credits to offset these costs, with Ontario and Quebec providing the most comprehensive support at the time of this recording. Markham Fertility Centre is an Ontario Fertility Program participant offering both funded and private IVF cycles across 5 locations. Welcome. My name is Dr. Marta Wise. I'm a fertility physician here at Markham Fertility Centre in Markham, Ontario, Canada, and I'm the co-host of My Fertility podcast. As a fertility physician, I work with patients every day who are trying to make sense of complex decisions. These videos are designed to give you clear, evidence-based information so you can feel more comfortable in the choices ahead. Now, here is a typical IVF cost breakdown. Have a look on the screen to see a more detailed table. IVF pricing is rarely a single number. The total will depend on which services or treatments your treatment plan requires. Here's typical cost breakdown in Canadian dollars on the screen. Again, there is the base IVF cycle fee, which will often include monitoring as well as the egg retrieval, fertilization, and possibly an embryo transfer, which is about $8,000 to $12,000 in Canada. Other costs can include the medications, which can be anywhere from about $3,000 to $7,000. Now, this will depend on the types of medications used, the dose of medications that are going to be used, and how long those medications will be used for. And again, this is always individualized to the patient and can be difficult to predict because it can be different for every single person in different cycles. Other add-ons that may be additional costs include ICSI, pre-implantation genetic testing, potentially embryo freezing, and annual storage fees. In total, though, for one complete cycle with some of the most common add-ons, the cost is probably going to be about $15,000 to $25,000 Canadian. Again, it's important to highlight there are key variables that will influence your total. So for instance, the age of the egg provider and ovarian response will have a very big impact. Higher medication doses are generally needed for patients with lower ovarian reserve, which will thereby increase drug costs. ICSI or ICSI is often recommended when sperm quality is low, either low count or low motility, and this can add $1,500 to $2,500 per cycle. Genetic testing or pre-implantation genetic testing of embryos is optional, but it is becoming increasingly common, especially for patients over age 35 or who have recurrent pregnancy loss. An important consideration as well in cost is the number of cycles that a patient may need to do to have success. It is realistic to imagine that many patients require 2 to 3 IVF cycles, thereby multiplying the total investment. If somebody is pursuing the use of donor eggs or donor sperm, there are additional costs associated with that are often billed separately. Let's consider IVF funding and coverage by province in Canada. Provincial support for IVF will vary significantly across Canada. So here's a table on the screen that has your full details. Here's a quick summary of some current programs. At Markham Fertility Centre, we practice in Ontario, Canada, and the province provides public funding as well as a tax credit. The government will pay for one IVF cycle per lifetime through the Ontario Fertility Program. You have to be under the age of 43 when you start the cycle. There is unlimited funding available for IUI at the time of this recording. There's also a new 25% tax credit up to $5,000 per year that is effective as of January 2025. For all patients, it is worth checking out whether your employer's health plan will include some fertility benefits. Some plans may include medications, they may cover blood tests or ultrasounds, or even the whole IVF procedure itself. Let's talk about what Ontario's fertility program actually covers. Now, this is definitely one of the most common questions that I get asked. So Ontario offers one of the strongest fertility funding frameworks in Canada right now. Under the Ontario Fertility Program, or OFP, one IVF cycle per lifetime is publicly funded for eligible residents with a valid OHIP card. What is included will be the monitoring, meaning blood work and ultrasounds, the egg retrieval procedure, fertilization, including ICSI if it's needed, the freezing of embryos, and all embryo transfers resulting from that particular cycle. So that may include fresh embryo transfer and frozen embryo transfers. It's important to highlight what is not included, and that is fertility medications, which on average can be about $5,000 per cycle. Embryo storage fees after the initial period are also not included in the funding. Pre-implantation genetic testing is optional and is not included under the funded program, as well as the use of donor sperm or donor eggs. If somebody will require additional IVF cycles beyond the first, that is not included under the funding. Eligibility requirements for the program include a valid Ontario Health Card or OHIP card, and the person who is providing the eggs, meaning the person who's going to undergo the stimulation and retrieval, has to be under the age of 43 at the time of the cycle start. Not all clinics will participate in the Ontario Fertility Program, and so you must be undergoing treatment at a participating OFP clinic. The Ontario Fertility Tax Credit, effective as of January 2025, provides additional relief. So 25% of eligible fertility expenses up to $5,000 per year will be refunded. And again, it's important to note that MFC is a participating program for OFP where we provide both funded IVF and funded IUI cycles. How can patients reduce IVF costs? There are several strategies that can help manage the financial burden of undergoing fertility treatments. First of all, check your employer benefits. A growing number of Canadian employers will include fertility coverage through programs like Progeny or Maven. They may cover medications and potentially even treatments. Compare clinic pricing. Different clinics will charge different amounts for IVF cycles and for various add-ons. It is okay to request an itemized estimate from multiple clinics to understand what is and is not included. Explore financing as well. Many clinics partner with financing companies like Medicard or iFinance or Hum for payment plans. Here at Markham Fertility Centre, we partner with Hum to provide financing options for patients. There are also grants that are available for patients who are going to be undergoing fertility treatments. Organizations like the Fertility Friends Foundation offers grants for IVF, egg donation, and surrogacy, so you should certainly check out their website. Again, there are tax credits that may be used for fertility treatments and for healthcare associated costs. So file for both the provincial fertility tax credit and the federal medical expense credit. So why should patients choose Markham Fertility Centre for their IVF cycle? Markham Fertility Centre has supported over 13,000 families since 1990 and participates in the Ontario Fertility Program, offering both funded IVF cycles and funded IUI cycles. We offer pain-free egg retrievals with an anesthesiologist present at every single procedure, and we are the only clinic in Ontario to do this. We have an on-site genetics program for PGT counseling and embryo screening at no additional cost for that genetic counseling component. We also provide cycle monitoring at 5 different locations across Ontario, including Markham, Barrie-Innisfil, Oshawa, Orillia, and Sudbury for convenient monitoring. We also pride ourselves on inclusive care for 2S LGBTQIA+ individuals, single patients, and those using donor gametes through a Health Canada approved program. We are adamant about providing transparent pricing with funded and private cycle cost breakdowns that are published on our clinic website. Hopefully I've covered a lot of information about the costs of IVF, especially in the province of Ontario and across Canada. As I wrap up this video, I just want to say that as you take in this information, I hope it gives you not just answers, but also a little bit more calm and a little bit more hope for what comes next. For more information about IVF and about Markham Fertility Centre, please follow us on YouTube at Markham Fertility Centre.